see what kind of applicants that we can get in. So we haven't forgot about that, but we want to make sure that we have all our ducks in a row, the responsibilities settled out, before we make an advertisement. So that'll be coming soon. So if you know anybody, let us know. There are a couple of other things that I wanted to talk to you about. Previously, we had mentioned the state opioid and stimulant 4.0. If you recall, several weeks ago, or at our last meeting, I indicated that the State Department of Mental Health and Addiction Services has revised the application process. Previously, our community got $3.4 million in state opioid and stimulant response funding. Because of the way they revised it, the application process, they opened it up to providers to respond directly to them and not have to go through the boards. Plus, they compressed the application process to 10 pages. It would have been very difficult for us as a board to represent adequately 11 different programs in a 10-page application. So we encourage the applicants to, or people that receive funding, agencies that receive funding in the past, to respond to the application directly. I believe most of them did. And then we submitted a very small, compared to what we received, application of some higher priority projects for us. We were supposed to get notice, applicants were supposed to get notice on or before October 1st. The federal grant SOS 3.1 ended September 30th, right? There will be some underspending in that grant and some carryover for, what do they call that? Extension, no cost extension, which are different than carryover. But here we sit 2 weeks from October 1st, and no one has been notified on if they've received funding or not. So that exposes the organizations that have continued to provide their services to financial risk if they are not funded directly by Ohio MHRSB. That could be problematic. And I'll say that I hope that, or I have a concern that risk, agencies are operating in good faith. They understand it's a competitive process, and that they aren't guaranteed funding, but they are operating in good faith. I would hope that in their process, Ohio MHRSB decides to make them whole, and if not, provide us guidance on how we might be able to fill in those financial gaps using any no-cost extension or carryover funds from the previous state opioid response funding. However, we have not received any direction on what to do with those funds either. So we're sitting in this holding pattern. Costs are accruing. We don't know what funds will be given to the agencies, and I hope that they're going to get all the funds plus more. There's potential for, getting more funds. But it is a very uncomfortable position for the board, for the agencies that are doing the funds. And I would hope that the state, the direction we get from them is they'll be making their decision very soon. I hope that is true so that we can figure out what's left, what we lost, what's left, what expanded, that kind of stuff, because we don't really know. We don't even know who applied. What the amounts were, because it was open to any nonprofit treatment, prevention, recovery, housing type organization. We are aware that and I'm switching gears a little bit now, we are aware that there is some overlap with some of the applications with the One Ohio Recovery Foundation funding. So that might provide some relief. One Ohio Recovery Foundation has made a preliminary decision regarding who should get funding for Region 4. That is not public knowledge as far as actually who, but they're not releasing those names, but the decision on what they believe, who they believe they're gonna fund has been made. And that's just pending now contract negotiations, because some of the requests have been reduced. One Ohio Foundation staff will then be negotiating with the organizations directly on, hey, can you do what you said you were gonna do with the reduced allocation? How does this fit with any state opioid response funding that you might have got, any board funding, any other funding? So there's this potential that some of that gap will be filled. I bring it up because here's what we know right now. We know we're on a trend where overdose-related deaths are down. And we also know that over the last year, overdoses have plateaued. So that we're not seeing increased overdoses this year as we've seen in years past. So what is happening is making a difference. And we want to make sure that we don't take steps backwards in the system. And you know, the opportunities to, you know, not just maintain the reductions and work on the overdoses and get them, you know, going down instead of plateauing. We want to make sure that we keep that moving in a positive fashion. So there's a lot of moving parts related to this. Our board funding will likely end up filling the gaps in the next coming fiscal year as this plays itself out. We obviously have, as you know, quite a bit of treatment funding going into it, and let's not discount that as a positive influence as well. Our treatment agencies are doing tremendous work around substance use in particular and mental health, but we're talking about substance use here. So there's a lot of positives that could be upset by not knowing what state opioid stimulus response funding is in a timely manner, not coordinating it with, not being able to coordinate it with the One Ohio Recovery Foundation. Of course, we've already made our allocations. And so there's a conversation to be had at the state level about how these funds are being brought into the community and the role the boards could play across the state, the 50 boards, on assuring that we maximize each one of those dollars versus a shotgun approach to whoever wrote the best grant or whoever paid the best grant writer to fill out their application. Now, some of that occurs, no doubt, but you know, I'm also aware that there's a lot of grassroots organizations in our community that will receive funding through this. Some of them will write really good grants, some of them won't write as good as grants as others. And I think that there is an intent that there will be some equitable distribution amongst these organizations by those entities. But if the boards across the state were more involved, there would be a better opportunity for them for that to be realized. That old adage of all healthcare is local, right? It plays out here each and every day. So I just want to kind of let you know about that kind of dynamic going on. And also something important happened that is kind of if you aren't paying attention to it, you won't even know what it means. But last month, the state received a temporary extension of their, what they call Medicaid Substance Use Disorder Waiver 1115. That's a lot of words to basically say the IMD exclusion is still suspended. And why is that important? Because that's what allows treatment agencies to expand beyond their 16 residential beds. So when this originally passed, it was a 5-year approval to address the opioid epidemic in particular. And so we saw a growth in detox facilities go from 16 beds to 20 beds to 40 beds to and so that's why it was allowed. If that waiver wasn't approved, they would have been limited to 16 beds, and then anything over that would just simply not be paid. Actually, you can't do it. It's not lawful. So that was quietly approved last month, and it is good through March 31st of 2025. My sense is that it's here to stay. And it, I think if not, it will have some pretty big implications on our detox providers. Now, I firmly believe we have, for our population, we probably have more detox beds than we need in Lucas County, because we see some beds coming up despite capacity discussions. We've seen some contraction of detox beds at one of our funded organizations, Zeph Center, because of the increased competition in other organizations creating their own detox facilities, and then that tells me that the market share is being dispersed even more. And what's important about that is they're our funded organization, right? They're our largest funded organization, and they do great work, but that goes to their bottom line. So if they have to staff 36 beds but can only fill 30, that six bed difference is a lot of money, but they still have to staff 36 beds. So I think you've heard me say it before, and I'll say it again. There isn't a metric that is used to determine how many detox beds Lucas County needs, how many inpatient residential mental health beds are needed, how many outpatient slots, how many across the continuum. That metric doesn't exist. There's a group that is trying, but I question it, to be honest with you. Yes, ma'am.
Is there a community out there that has these metrics?
No, that's my point. It doesn't exist.
It just does not
it does
exist.
not
Like,
exist.
there's no way to know, right?
And
Which makes sense to me. I mean, it would scare me if we actually knew.
more importantly, or just as importantly, is because that doesn't exist, we get a proliferation of people who have a perceived need that there's this, that there's a perceived need for more treatment agencies. On a weekly basis, we see additional treatment agencies coming in or making application. And what that does is that disperses the workforce, and I'm not judging that harshly. It creates opportunities for our workforce, but it also disperses them across entities that might not do the same things that a Harbor, Unison, Zephyr, New Concepts, in particular, Ohio Guidestone would do. Yes, ma'am.
Do the rural counties have access to detox beds? They don't have them in their own counties.
Many rural counties will partner, actually all have to partner to have some level of accessibility for detox. You've heard me talk about regional funds here before. Some of our regional funds go towards creating detox opportunities in those rural communities in our 23 county district. So yeah, but we do find that, you know, some folks may end up here on Medicaid or even by a contract, which is fine if they're gonna fill up the beds, provided they go home afterwards. You know, which isn't always the case, especially if you're out of state. It's just one of those things that, as I link SOS and the One Ohio Recovery Foundation and our funding, and then I talk about the growth of providers, and then the dispersion of workforce. My opinion is that there needs to be an overarching state plan on how to approach this. You know, if you wanted to bring a hospital into Lucas County, you would have to go through a number of different hoops in order to establish a hospital. One of those hoops is determining need. That doesn't exist in our system. And then it puts more pressure on our existing community mental health centers who serve the most acute patients, to handle a higher concentration of those patients. And it's this dynamic isn't new. It's just something I wanted to remind you of as, because all these things are connected in some way, shape, or form. And so, which brings me to one of the other long-winded things that I wanted to talk about quickly. Still got 20 minutes.
Scott, may I ask a question about
Sure.
what you were talking about? So you said you felt there was a need for some, I don't know, overarching plan. So if I just decided I wanted to open Jeff's treatment plan bed, you know, and have X, that I would need to go through like a hospital, right? So as a citizen, what do I do to maybe reach out to whoever and say this is something that concerns me?
So I want to just kind of reframe your, if you have a license, or maybe even a desire and the ability to recruit somebody with a license, you can establish your own treatment agency. It's done all the time, Ohio Mass certification. Of course, if you have an independent license, you can go on your own. You don't have a certification. Because Ohio is any willing provider state, they will also automatically, once they jump through all the hoops, get a Medicaid contract. And that is what most organizations do. They get a Medicaid contract and they build their business on Medicaid. What I believe we need to focus on is, and I'm not throwing shade on that group, I believe we need to focus on quality. Right? And when you have a transient workforce that jumps and jumps and jumps, chasing dollars, which good for them, right? It's hard to build quality. And so I think that's the first thing we should be advocating is quality. How are we showing? We monitor our agencies for quality, right? Well, what's happening with those others? And how is that being looked at? You know, and we have some large treatment agencies that that aren't affiliated with us that, you know, have figured it out. But then there's a lot of small ones that haven't.
78 beds are being added in January, February,
Right.
whenever CARF, you know, I mean, that's 78 more beds that are gonna be, we're already talking, we have a glut.
I'm not sure those are sustainable unless you have, and I don't mean you, unless there is a plan for how those are regionalized. Because, you know, and that plays out with all of them, so it's not just where those 78 beds are showing up. That will have, you'll have a ripple effect. Maybe they do a better job of recruiting, so now Zeph Center, who I mentioned, maybe they're only filling 20 of their 36 beds. Well, they gotta figure out a plan for how to fill those or reduce.
Right, and there's no attention to quality, like who's doing it right?
And, well, and that's, we know we're monitoring ours, we know ours, right? And I think that's the difficulty in this any willing provider arena. You know, Medicaid will look at billing, but are they doing utilization reviews? And how are, you know, and if they are doing a utilization review, is it in response to something? Usually a complaint.
And does that also include the for-profit? So, cause some are nonprofit, some are for-profit.
Yeah,
And so,
the state doesn't make it, in most instances, the state doesn't make a determination between for-profit and nonprofit.
okay,
And by the way, there's a difference between for-profits that are from this community and build up this community, and for-profits that are carpetbaggers.
Yes.
right,
Come in, they know there's a thing, they set up, they try and get their money.
or some national firm that opens them up across, yeah.
There's a big
I just
difference
wanted to
between
make
those.
the,
David, you had a question?
Yeah, remind us what drives the certificate of need process that you talk about with the hospital with, is it the funding from the feds? Is it regulatory? It may go to Jeff's question about, you know, where the pressure points are to get a similar kind of program, a front-end certificate of need as opposed to.
Right. You hit the language, right? There is a certificate of need that is actually developed or given for the development of a hospital in a new area. They have to be certified somehow. I don't know how that is, and I don't know what the metrics are for that.
I don't know,
Census
I
is
don't know if it's
population
joint
and need.
commission,
Yeah.
yeah,
I think it's front end, I think it's driven, I mean, there was a time when if you wanted a new MRI machine, you had to get a certificate.
Exactly.
I think that's been relaxed, but.
interesting, I
It
didn't know.
reminds me of the trades. Somebody has a pickup truck and they slap a sign on the side of it and say they're a plumber, or they're a carpenter. That's kind of the way it looks with a lot of these small agencies that come in. But
Yeah, I mean,
it's too bad that some of those beds couldn't be called mental health beds, because there aren't very many.
well, you know the reason for that. The reason for that is because Ohio Mass doesn't have a mental health residential reimbursement rate. You get a mental health reimbursement rate for residential services and you'll have mental health beds. It's a simple explanation to a complex,
Unless they're dual, then you can put them in that bed.
and that does occur. But yeah, I mean, it's the same with crisis. You know, give me a crisis stabilization unit day rate, and you'll see the proliferation of these. It's something that I just wanted to remind you about because it all ties to all of this. We do know that services are costing more, right? We increased our, we had a discussion of POS increase rates last week, or last month, sorry. And there is a recognition by the federal government that that administrative rates have increased. There was a rule that was established that just came into effect for contracts made after October 1st that allowed up to a 15% increase, up to 15% administrative expense, or a federally indirect rate. And we're trying to evaluate what that means for us. We do know that the agencies have an increased administrative cost. We do believe that that this federal rule, binds us to increasing the federal or the rate to 15% where it is now 10. But what we don't know is all the little other particulars around, does it apply to all of our funds or just federal funds? Is it up to 15% or is it a flat 15? We do know that if they have an indirect rate that is negotiated with the feds, that we have to accept that. So there's a lot of these little nuances that will help us address a concern that board staff have had over the last several months about a lower than what we know is needed administrative rate. Now, where that complication comes in is if you increase the administrative rate by, let's say, what would be arguably at least 50%, and you don't give any additional money, and where's that additional percent gotta come from? It's gotta come from somewhere, right? So it's gotta come from program and service. And that'll be the struggle. Are we going to be okay with expanding a administrative rate and seeing some less service because of that? And that, once again, leads us down the road to priority discussions with our POS conversation, with these program conversations. There's a real need out there. We're gonna, I guess, by rule, have to follow some of that. And then what's the equity like for others, right? I mean, you get federal dollars, you don't, I'm gonna give you 50%, no, you gotta stay at 10? That doesn't sound right, does it? So there's some complications that are coming down the road here that we're working on. Jenny's on board with them. We're communicating with the providers on what's going on with that. And what they're seeing. We've actually delayed some reporting so that we don't have to report twice, but there's a real potential of having to redo budgets because of this and cause some additional angst that we didn't plan for.
And just wanted to mention too that in addiction, it's the nature of the beast changes. I mean, we talk about 20 years ago when everybody was fighting tobacco, and then all of a sudden we did very well. We're up to vaping. Just it's a tobacco product. I'm just using tobacco. But the nature of the beast changes, and so that's hard to look at when you look at addiction, what services, because there's all these new drugs, new highs that come out, and so that also, when you throw that in, makes it difficult to speculate or to look at what your treatment needs are.
Absolutely, and the agencies do a really pretty good job of crystal balling the future, trying to align their services for, whatever's coming down the pipe there. Sunny, you had a question, I think.
When Andrea made that mention, I just thought of fentanyl, just popped into my head. I mean, 5 years ago, I don't think I even knew what that drug was. And today,
Or heroin, opiates, fentanyl, and now
Today,
xylazines come in.
yeah,
We don't see a lot of it, but we're gonna see it. And oh, by the way, let's make marijuana legal. And
and
not
that,
expect,
yeah, that's where my
medications
concern
related to
comes in, cause I just, I try and read anything I can, I come across about fentanyl. And a lot of marijuana that's bought on the streets is laced with fentanyl, which is causing deaths. don't
Yeah,
know,
I'm
there's
not-
no easy way to say that word, but, and I was just like, wow, wait a minute.
Yeah, I don't have the latest data on what's being found in marijuana and, you know, laced in cocaine and stuff like that. I mean, there's data out there, I just don't have it here, but.
Yeah, and I just, when you said that, when Andrea said that, it triggered that whole thought process of, wow, you know, fentanyl, like, who heard of it?
So I just, oh, go ahead.
Just to be a bit contrarian, I'm worried, and I encourage you and board staff to keep a close eye on an increase in management, an increase in assistant managers and middle managers and folks that make some other people's jobs a little easier but don't really contribute to the services that the agency should be providing. It's very easy to say, well, now we've got an extra 5% for administration, so let's go hire a bunch of people that we didn't need yesterday. And I know I'm stating the obvious, and I know you're gonna look at it, but I just wanted to get that on the record.
Well, I appreciate that. I think in our larger budgets, we won't see, well, I'm gonna rephrase that. I think what we'll see is that increase will go towards costs that are already incurring versus a growth spurt in, over and above what, you know, they've already incurred, so. But we'll definitely, when they do redo their budgets, they have to tell us that kind of information, so thank you for that.
So what's the timeline for all of this?
Well, I wish I knew. I don't have a timeline, which you and I started talking earlier today about the uneasiness of the system, because we hope that we'll find out what the SOS is shortly. The One Ohio is we're gonna know that soon enough. What we won't know is how they coordinate and how they overlap and what are the issues around that and who wins, who loses, that kind of stuff. And then is there a response that we need to do? My sense is short term, before the end of the year, which may lead nicely into the old dreaded discussion of strategic planning, which we'll need to do early next year. And then obviously falls into line with our fiscal year 26 purchasing plan discussions.
Potentially, it could change drastically.
It could. And let's remember Jenny's financial forecast that's already put us in a conversation of retraction over the next couple of years. Modest, minor retractions, if $500,000 is minor. So I don't want to leave you on a sour note. We have some cool things that have happened over the last couple weeks as well, and I'm gonna ask Michael to come in and give us a little update on some things that we worked on last week.
Well, I'll start with talking about the podium and microphones.
That's pretty cool. As you can see, we have a new podium to be able to help us facilitate our meetings. Many of you were here in our last meeting, but you will see the addition of the saucer-like microphone that is in the middle of the ceiling, which is our speaker that helps us with accessibility and sound to the back, because many of you may not have realized as you were communicating that we could not hear sound back here as well. And then you can sometimes realize talking from back here forward, we couldn't hear as well. They couldn't hear it online as well. So now those issues have been resolved. You were heard very well today in the meeting. I think everyone had access to being able to hear you very clearly. I've been getting texts from online. The sound is very, very well. We can hear papers, we can hear whispers, we can hear everything at this point now. And so that just helps us with our accessibility. So that's really exciting. We also have devices for those who are a little more hard of hearing that will be available, and we will have them sitting out in our next meeting that you would be able to use and hear very crystal clear sound from those as well. And it's the same sound that's going directly to the audience. So I wanted to point that out. This week we're using the corded mic so that our vendor is able to get that sound to our audience, but we'll have our wireless mic back here that will allow everyone that's speaking from the audience to address you. They'll be able to come to the podium, speak at the mic, and it just gives us a lot more professional feel for what we're doing. So that's pretty exciting. I see it look like they're trying to get me back. You may have noticed when we first came in, we had a collage, there we go, the picture collage up. Many of you, we say thank you for signing the posters that they're holding in their hands a couple of weeks ago. And we came up and we talked about First Responder Appreciation Week. These are some of the stops we went to. We went to 30 different firehouses across Lucas County, not just Toledo. And in doing so, we received great appreciation from first responders and firefighters, but we also received messages afterwards that have come back to us thanking us. We were able to order cookies from them that were fresh baked and put into jars. And you can see some of the guys holding the jars in a few of the pictures. They were very much appreciative and excited about that extra touch, but they really did love the posters. The fact that one of their own was on it made a big deal, right? Someone that they could recognize from any of them. And two, the fact that we put messages on there meant that we actually cared and we took our time. And that's what we kept hearing, that thank you for actually caring. And we've had a couple people stop us to ask questions about having a hard time. What about if they're struggling? What if they're in crisis? So we were also able to have some very good, heartwarming conversations, as well as give them resources and point them to resources. So I think our team did a phenomenal job. So thank you to all of you for your signature. And I just thought, Scott thought that it would be great for you to hear that thank you and to get a chance to see a smile of what you were able to help accomplish, because we all did that together. You guys, along with staff and members at the Warner Center, all had an opportunity to sign. So that was great. And then finally, our app. Many of you know that last year this time we rolled out our app, right? And it's been exciting that we've had great results with it. Well, there's been an update to the app. There's a new version of the app that is now becoming available. We're getting ready to roll it out hopefully over the next 30 days. We're waiting to get a few more of our agencies enrolled into the new model. So hopefully next meeting, board meeting, when we come back, we should be able to announce how that's going to look and you be able to actually see it. Today I'll tell you a little bit about it, but you'll be able to see it. One of the things that you're going to see differently with the new app is going to be that it will actually be searchable. So now you click, you're looking for a therapist, but you'll actually be able to search what type of therapist you're looking for and maybe some of those subcategories of a therapist you were looking for. And it's going to bring up an answer with the agencies that's closest to where your location is. So if you're in 43609, it's going to bring up agencies closest to 43609. If you're in 04, it's going to bring up agencies close to 04. If you're in 15, and so on. The other thing it'll do is if you don't have that available, then this will become the location for you, and it will bring those locations up. So we're really excited about having that searchable feature, because there's certain subcategories that you may be looking for something very specific, and you don't know what that is, but you kind of got an idea. At least when you start typing, it'll also give you a recommendation of maybe what you're looking for. So that may even help those who are unsure be able to figure out, you know what, I'm not quite sure what I'm looking for, but I think that's it. They'll at least get a lot closer to what it was that maybe they wanted to have. Or they heard of an agency, they can type that agency in and see if that agency comes up and is available to us. The QR code is going to be the same. The web link is going to be the same. So the only actual difference is going to be that the functionality is going to change. So if you already have it on your phone, you won't have to do anything different. You literally are just going to hit it and it's going to look different. It's going to have highlighted resources. We have links that are going to take you to things that currently you don't have access to. Ohio Driver Intervention Program, for example, is now going to be linked directly to it. You don't have to call and have a phone ring and get a voicemail message. You're going to be able to click right on to resources in our highlighted area and find all the driver intervention programs. You'll be able to find all the opiate treatment providers that are available within Lucas County. Our navigators are going to be available as a highlighted resource to them, so they're going to be able to know immediately where a navigator is. So if the peer program isn't working for them and they're not able to figure out how to get through crisis, then we have a third option, right? We have navigators who may be able to help them find the resources and connect to the system. So I'm very excited about that ability to be able to do some of those things and get resources in the hands of the people who need it the most, the fastest, right? And so that's really what it's about. It's about accessibility, and that's what our DEI BA efforts are about right now. They're about accessibility, access, making sure those who need the services the most have access when they need it and how they need it in a way that will allow them to receive that services and allow us to see that our efforts are actually working.
That's great. I have a question. So now, if you live in 604, you wanted someone to help you in 604 to take you right to that. But suppose last year you were seeing someone in 615.
Yeah.
Would it also give you that availability as well?
It will pull them all up. It's just going to show you the ones that's closest to you first. So it's going to geofence you and say, hey, Dr. Gordon, you're in this zip code. Here's what's closest to you. But if you scroll down, all of them will still
So
pop
you still
up.
have the option.
You still have access to everything. Right. It's just giving them that opportunity to see what's closest to them. So one, they don't have to go look further. Two, the other thing that it does is it makes it to where all of the agencies have access to being seen. Because right now it would simply just be on alphabetical order. That's how the current version is. But once it's changed, it won't be on alphabetical order. So if your name's Attain, I'll just pick on them because I know they're in there, right? So if your name's Attain, it's an A. You're always going to be near the top. You're going to be somewhere at the top of that. And if you're Zeph, you're always at the bottom, right? A to Z. You see what I'm saying? You're always at the bottom. But now you will have that difference of if you're close to Zeph, it doesn't matter what the letter is, you're gonna pop up because you're right by their location. Any other question? Yes,
What's
ma'am.
an example of the searchable subcategories?
LGBTQIA, African American. Those are Hispanic. Those would be some of those subcategories, woman, that you would be looking for if you're looking for treatment in any of those areas. And so those subcategories are going to be very important because there's a lot of people that are looking for treatment from people that look like them or at least understand them. And we're asking extra questions that's built into the app, and you'll be able to see that. So it's not just, are you an ally or do you have a rainbow on your building? We're asking questions that's going to let you know that the treatment you're looking for is from someone who actually treats you, right? And not just say they treat you or not just say that you're accepted, but we actually know that we're asking for an African-American therapist, that more than likely there's a therapist that's African-American in the building. If you're looking for someone bicultural's in the building, not that you have to go through a service to find proprio, right? Like right now, we know everyone has proprio or something similar available, but we understand that they want to have bicultural opportunities as well. So we're asking an extra layer of question that they have to actually answer in the survey that lets us know, and then that determines where they pop up at and populate.
So we're asking questions of the service providers,
Yes.
not the.
Of the service
client.
provider.
Okay.
So then as the end user, what you're seeing is more accurate because the service provider had to actually answer questions that would lead to them popping up and populating versus they went through training, right? Yeah, we got you went through training, but that doesn't mean you're an ally. Or that doesn't mean you have an African-American therapist. You may have an African-American caseworker. We're not talking caseworker at that point. We're talking therapy. So yeah, a little more access.
And how frequently is that information updated? How
So
current is
that's
it?
the cadence we're gonna have to work on. So right now, we're looking at touching base with them every 6 months, because right now, we don't know if we have the manpower to do it quarterly or not. So right now, it's every 6 months that we've talked with the SIN, so it's twice a year that is updated. And that may not be as judicious as people would like, but it's a lot better than what we have today.
Is there any value in asking them as part of their commitment to being part of our app that they notify us of changes?
Absolutely. So one of the things that we're hoping is going to happen from this, and we're pushing, is that you'll notice the people that are in there right now are the people who are part of our inclusion council. So if they've been to our inclusion council meetings that happen every other month, they were the ones that were there first. So we're hoping that they all will become a part of the inclusion council. So we would see them every other month, and we will kind of know what those changes are. And so yes, to your point. But the other benefit to the new app is in the past, we had to do all the survey, all the updating, And then if you know anything about JSON files, we had to do that and upload it. We don't do that anymore. Now they have a survey that they can complete at any point. They want to do it 20 times a day, they do, and all we have to do is approve it. So we just hit approve and it goes live. So that's the benefit now, that if someone moves or change, they can hit that button and they can make that adjustment immediately. And then if we hear about it as well, we can touch base. But we're hoping having them a part of the Inclusion Council is going to make it to where we're able to have that connection and actually have relationship and partnership and not just have a checkbox in our system. That's the hope. That's all about the hand.
Yeah, forgive me, I'm relatively new on the board, and so I'm not that familiar. I'm not familiar with the app, let me be honest. So who is the audience for using the app? Is it people who would get services from people who we fund, or could anybody who perhaps used private insurance and wanted to find a therapist that was LGBTQ friendly?
Glad you asked that question. So the end user is anyone who needs services in Lucas County, period. Any kind of mental health service, substance use service, in prevention service in Lucas County, anyone, end user, right? We're also targeting what we call the helpers, so that the social workers, the first responders, and everyone else who would recommend, make a referral to the app, so that if they know of someone who's in crisis or could benefit from the app, they would be able to utilize it. But the ultimate end user is any consumer in Lucas County who needs the help. To your point, we have currently 50 providers within our app, right? And so that means more than 25 to 30 of them are not currently funded by us. Anyone's in there. So you've got the Team Recoveries, Midwest Recoveries, and so on. They're all in the app, right? And so what happens now is you go down and it just says there's insurance. What we have asked for in the new version is that it's searchable. Private insurance, Medicaid, board pay. There's a way that they're able to search out what is available to them. So if they don't have insurance or if they don't know if they can pay for that service, there's an indicator there to help them at least know that there's some help there. They may have to make the call, right? Because it doesn't stop you from having to make the call. It doesn't preclude the call. But it at least let you know that they accept my insurance or they don't, right? Because they hit maybe it's Medicaid, right? Or I have private insurance. I don't know if they take Blue Cross or not, but they take private pay, or it's out of pocket, or it's board pay. And they then know they can make that call and ask about it. They saw it on the app. And it's not just who we fund. Now, there is a area on the app that we're fine tuning, right? That would list board paid services. So that if an individual needed to know, hey, I'm in an emergency, I need help, I don't want to look through 100 people, who are the board paid services if I don't have insurance, they're going to be able to find their tear sheet. And it's called a tear sheet, and that'll be in there as well.
Thank you.
Hopefully I answered all of your questions. Thank you.
Thank you much.
And you know what, could you just do one more favor for the people that are newer?
Yes, ma'am.
Help them get the app on their phone?
Yes, I'm glad you said that. So there's a little, it depends on if you have an iPhone or an Android currently, but if you go to lucas.localhelpnow.com, that is the easiest way to download it, right? So you can just put lucas.localhelpnowapp.com, right? That's the easiest way.
Can't get it in the App Store?
No, because even though it's an app, it functions as a website. But you can always do lcmentallyWell/local help now, right? Once you get it up though, so once the app comes up for you, and it looks like this, for most of us, we can hit this little arrow down at the bottom for share and scroll down and add it to home screen.
Could you give me that web address again?
lucas.localhelpnowapp.com. And I'll be around afterwards so I can help anyone do it in a few moments when we're done and show you how to load it to your home screen. And just having it on your home screen could be very valuable. I know our team has found out for the community engagement equity team, just being out in the field, someone will ask a question or they seen that billboard and you hit the button. And you'll be surprised. We had the banner in the, what's the name of the place? Wildlife Play at? Huntington Center. I was drawing a blank. So we've had a banner in the Huntington Center. We've been at Mud Hands. So you may just be out and about and someone sees it and you hear a comment, you'll be able to hit that button and show them how to access it. Okay.
And it's true, you'd be amazed that once you have that resource,
I use it all the time.
Yeah, and so it's gonna become a lot more judicious for us to use. It'll be something that you guys can really be proud of. And he's still, yep.
Can you say again when the update version?
We're hoping to have it done within sooner than 30 days, so by the next meeting. We're just trying to give a few of our providers currently who are not in the system a chance to get in so that when we roll out, we have as many people in as possible. So before Thanksgiving for sure.
we don't have to do anything to update the app. The app is.
It's gonna update
because
automatically.
It's a website.
Yep, that's the beauty. You do not have to go into a app store and load and update. It's automatically gonna update for you when it rolls out. And the other thing that I probably should have mentioned since I'm up here, and that is language, because that's one of the questions people ask about. Whatever language your phone is set to, that's the language the app will come up in. So if your language on your phone is set to Spanish, the app is gonna populate in Spanish. If it's set to Arabic, it's gonna pop up in Arabic. So whatever your
That's
dominant language
amazing.
is, the app is gonna show up in that language. You don't have to go looking for how to change it to that language. It's automatically integrated.
And is
into
that gonna
the
be
setup.
part of the new update?
That's part of the new update. Yeah. So, awesome, thank you.
Thank you.
Thank you,
Just
Michael.
That's phenomenal.
two other things that are going on this weekend. If you're out and about around town, Saturday and Sunday, Tent City, there's a mental health tent down there. Stop by, say hi to, there'll be some providers in there. And
Saturday and Sunday?
Saturday and Sunday, yeah, it starts Friday night, it goes all day Saturday, and then it usually ends around, at least in the past, around noon on Sunday. And then we will be participating at this Saturday, Child Protection Services, CSB's Trunk or Treat. That is probably one of the biggest Halloween events in the city. 3,000 kids. There'll be a bunch of folks. They're dispersing candy. I know we're gonna be purchasing a bunch. And if you wanna come by and help the team pass out candy, come on by. We can always use the hand.
So what day? It's time.
That's Saturday, location, time, we can send that out. Pardon me?
It's usually at Libby, right? Oh,
It's at the Believe Center, yeah.
What time?
Time, 12 o'clock?
No.
Be at Libby. It's-
That's my director's report. Thank you, Michael.
Thank you.
Thank you.
Thank you, Michael.
Ended on a great note.
Good session, we're not quite done yet.
Scott, can I
Yes,
say something? I just want to say thank you to the board for supporting the Hispanic Month. And I attended the Diamante Award, which was very nice, very well. The presentation was very good, and I just want to say thank you to the Mental Health Board to supporting it.
All right, so now we'll have open session, and if you speak for open session, we're gonna ask you to come to the podium so you can be heard. So Richard, please, and if you'll step to the podium.
A lot going on at One Government Center. I'll try to be brief. Last week, very long agenda at Plan Commission. At the daycare center at 111 West Bancroft, they have their drop-off right on Bancroft. They want to accommodate 45 kids, and that's very dangerous. So they've asked for a 60-day deferment. They'll be heard at the December meeting and probably heard by City Council next month or next year. It was painful to sit through, but the Bernath Parkway, the Sheets, what do you call it, convenience store, gas station. Last month, all of the elderly neighbors hobbled in on their canes and walkers and wheelchairs and said, please don't put this in our neighborhood. It was a tie vote. That's very rare. So it goes to the next month. They did the same thing last week, and one of the members did change their vote. So that will go before City Council on November the 12th. I would imagine it will be approved. As we speak, City Council's zoning and planning is meeting. They probably are going to approve one more smoke shop. It's at 135 South Burn. That owner has another one already operating. I think they'll approve. And then they will probably vote on a moratorium on tobacco shops until sometime next year. And if they do it at the meeting this afternoon, then it'll be voted on in 2 weeks and become official. Tomorrow, with City Council, I'm not real happy with them. At their agenda review, they're going to reverse themselves. Up until this year, City Council meetings were always on Tuesday. It's actually written in Toledo Municipal Code. They had to change that and moved it to Wednesday. Tomorrow, they're going to move it back. If I understand correctly, all city council meetings and agenda review moved back to Tuesday, and then zoning and planning moved back to Wednesday. There's no opportunity for public input. There wasn't last year either. I'll find out hopefully more tomorrow. County commissioners continue to hear from all of their agencies this morning. Scott was there. They did the family council. They looked at the budget for sanitary engineer, county engineer. Then they had another meeting this afternoon, county recorder, and a very interesting meeting with the Board of Elections. Everybody knows that they need to keep their budget very, very tight, but they are under all kinds of pressure under there. Things like the citizen petition drives, that causes problems for them. There is a bill in the legislature, the Ohio legislature right now, which if it is passed, it's one of those unfunded mandates. It will say, we want you to verify the citizenship of every single voter in Lucas County, and how you pay for it is your problem. It's unfunded mandates. And so they gave their presentation. Commissioner Gerken had more than a few things to say about that. And they will continue with these hearings up until November the 19th, and then hopefully sometime in December, the county commissioners will have their budget put together. So very, very busy over at City Council, and just indulge me for a couple of moments. The city of Detroit's just in shock. This is a developing story. This is today's. A police officer opened fire on his colleagues and had to be shot to death. What little they know, he was a member, it's not the SWAT team, he was a member of the Special Response Unit. That's the unit that responds to active shooters, barricaded gunmen, all of that. He had just returned October the 3rd from a physical disability. He had no mental health concerns at all. But they received a 911 suicide in progress called. When the Detroit police got there, he opened fire, wounded 2 of them. Then other cops had to shoot him. He was in uniform at the time, off duty, but in uniform. And now the finger pointing starts. I'm sure there'll be an investigation. Could this have been prevented? But you can only imagine what it's like for the officers that were shot and the officers who were forced to shoot one of their own colleagues. And it illustrates the need that for law enforcement, we have got to get them mental health help as soon as possible. I was talking with it over at people at one government center. Yeah, we have similar problems here in Lucas County. And we're coming up on a dubious anniversary. It's going to be 30 years since the mayor made his famous comments, can we move the deaf people to the airport? For anybody too young to remember this, it was November the 4th of 1994, it broke in the blade. He addressed his staff and said, can we move deaf people out to the airport? Surely they won't be, have a problem with the planes passing over. Very misguided, even though they're, anybody with an ounce of common sense knows they could be affected by the vibrations. Some people laughed, some didn't laugh at all. There was a flurry of activity at one government center. Most of city council ran for cover and said, we don't want any part of this. It made the national news. It gave us some publicity we didn't need, and it became a Toledo legend. Now, I've been talking with people over at City Council. November the 4th is the 30th anniversary. Bad timing. It's just the day before the election. But can we in some way, observe this, not celebrate, observe it and look at what progress we've made in the last 30 years. We've become a disability-friendly city. Same thing can be said for the county. And, what can we do in the future? Because remember, back in 1994, people with hearing impairments were the deaf, and people with mental health concerns were mental patients. And remember, mental patient wasn't meant to be offensive. It's just that back in 1994, you thought about the state hospital. That's where they lived. The state hospitals, you called them mental patients. So on the dubious anniversary of this Toledo legend, let's take a look at how we can improve this in the future. We never want this to happen again. But we have made a lot of progress. There's more progress to make. But like I said, November the 4th is going to be the 30th anniversary. I'm asking City Council if in some way they'll observe that. So thank you for the opportunity to speak.
Thank you, Richard.
Is there anyone else?
Categories.
Meeting adjourned.
Categories or.
Not too bad. Thank you, everybody.
Thank you.